Hi, this is Marcy White at Copley Acupuncture. I wanted to discuss a topic today that is one of the number one reasons I see people in my practice, and that is for neuropathy of the hands and feet, predominantly in the feet. And the reason why we see so much neuropathy in the feet is that typically these types of issues begin in the area that's furthest away from the brain. And so one of the things I'd like to tell prospective patients that are coming in for this condition is to understand acupuncture isn't something that works quickly for neuropathy. It does require some patience. You have damage to these nerves, so it does take some time. And most people that are coming in for acupuncture for neuropathy aren't coming at the beginning of this process. It's usually been going on quite a long time, and that's just in my experience. And it may have been years that this has been going on, and the frustration builds and the discomfort builds, and then a lot of people decide to try this as a treatment. So acupuncture has some amazing effects in being able to reduce inflammation, increase blood flow, help with cellular energy, and repair damage to tissue like nerves. However, we have to look at other underlying mechanisms that are driving the neuropathy. So it's not enough to just treat the hands and feet, but we have to see if there are some other things that are causing this, and there's always an underlying mechanism. One of the most common causes is diabetes, type 2 diabetes. The other is chemotherapy-induced neuropathies. There are also some neuropathies caused by spinal issues where the spine is squeezing. Actually, the spinal canal is narrowing, that's spinal stenosis, and squeezing the nerves. I have seen this as well. But I would say that diabetes and chemo-induced are the two common ones that I see. Some helpful information for you and some things that aren't commonly known is if you have type 2 diabetes, one of the most commonly prescribed medications is metformin. Metformin is helping to regulate your blood sugar, but one thing that it does, unfortunately, is it depletes your B12 vitamins. It's using that B12. When your B12 vitamins are reduced, you can get neuropathy. So B12 deficiency is a cause of neuropathy. So I know this sounds ironic that you are trying to take medication to help the diabetes, which should in turn help the neuropathy, but now you're creating a B12 deficiency. So this is something that needs to be looked at in practice. Another issue is cholesterol. High cholesterol is a medical condition that is very frequently diagnosed in this country, and one of the number one drugs prescribed are statin drugs to help lower your cholesterol. The problem with that is cholesterol is needed for a lot of functions in your body. Cholesterol makes all of the sex hormones for men and for women, and you need cholesterol to make something called coenzyme Q10. Coenzyme Q10 is not something made easily in the body. A lot of it comes from diet. So things like steak and avocados have high levels of CoQ10, but to get enough CoQ10 that you would need on a daily basis, you'd have to eat like 60 avocados, which is unreasonable. So many people take it as a supplement. Now, statin drugs lower your CoQ10, and what CoQ10 does is it goes into the mitochondria of our cells, which is where all the energy in cells is produced, and it converts into something called ubiquinol, which is what is the usable form of this. And once you have that production, you can get more energy into the cells. So high cholesterol, statin drugs, you lower the cholesterol, you lower that CoQ10, and that can lead to things like neuropathy. So this is problematic because if you're on metformin, if you're on statin drugs, that can actually be causing the neuropathy. And if those things are not addressed, if these B12 vitamins, if the CoQ10 are not increased in the body, you just can't heal. So you can do all the acupuncture you want. If things are left unmanaged, let's say that the diabetes in general is just not being managed well, and your hemoglobin A1C, which is a marker of blood sugar averages over 3 months, is too high, it's hard to heal anything when the metabolic system is not functioning if there's nutritional deficiencies. So when you come in here and you work with me, I look at the whole clinical picture. We're not just going to put needles in your feet. It just isn't enough. But I just thought these would be some interesting facts for people that they're just not fully aware of. If you have any questions, please let me know. I'm always happy to discuss this further. And thank you so much for watching. I appreciate it.